actually experienced, friends, and when I go to my church, people who have said, my doctor said, I don't know what happened. You have this diagnosis. It's gone. Can't explain it. Science can't explain it. Well, it's because there are things that we don't understand about God. And if we can allow that portion into our medical profession, I even say, dare I say, that as we're seeing the medical profession looking and searching for answers, that this is a part of the answer that they're looking for, but they're refusing it. So 85% believe the influence was positive. Are we good on time? Okay, perfect. So 85% believe the influence was positive, and 7% reported negative effects. I would believe that negative effect would have a lot to do with the person's interpretation of religion and spirituality, and whether that was intrinsic versus extrinsic beliefs. So intrinsic beliefs are those where we're actually motivated, internally motivated of ourselves and of our own free will to seek that higher power, to seek God, as opposed to, my great-grandma did it, so I guess I'm just going to go to church. I just do it because that's what we do. But there is no real faith there. There's no true belief system there. So you're not going to get the effect because you're not really believing in the power of God. You're not really believing in the power that exists. So that's what I would believe. And 76% reported coping benefits to their patients. 74% reported a promotion of a positive state of mind. And 55% report a promotion of emotional and practical support. So this is what's really very vitally important to me. Again, not only as a psychologist, but also the medical professionals who are here. Because you'll find that the positive resources that your clients and patients have will directly impact whether or not they follow the regimens that you're giving them, or whether they just kind of throw up their hands and say, you can't really help me, so I'm not really going to do what you tell me to do. I'm not going to come for my follow-up checkups. I'm not going to do any of those things, because ultimately there is not a positive state of mind that's needed to fight cancer, that's needed to fight these various medical conditions. So again, there was another study that was done where they surveyed 1,000 physicians. 56 believe spirituality has a significant effect on health. I'm going to kind of move forward here. Spirituality and psychology. So what exactly are we talking about? Well, how do we define it? Operationally, this is how we define it. Spirituality is an individual's understanding of, experience with, and connection to that which transcends the self. In our case, that would be God. That would be Jehovah through Jesus Christ. Others, again, we've got to accept the fact that not everyone is a Christian. So, the personal, intimate, and dual interaction between the individual and God. So this means that when we pray, we're actually seeking Him. And we actually believe He hears. And we actually believe that He responds. And not only do I just think it, but I feel it. There's an intensity. If you close your eyes and you think about something wonderful, you feel it in your body. It changes and it shifts. That's what the power of prayer does. So that is an operational definition of spirituality, which transcends the human experience. And then religion. Religion is a system of beliefs, values, rituals, practices shared and counted by a social community as a means of experiencing and connecting with the sacred or the divine. So what that means is, I'm going to do this just right. I got to go to church 5 times a week. I've got to make sure that I wear this outfit. I've got to do this. I've got to do that. I've got to turn around 5 times. And I'm not trying to admit, I'm not dismissive. I'm really just acknowledging that there's intrinsic and extrinsic. And the intrinsic is where I really believe the stuff that I'm talking about. And I really am expecting that there's going to be a response. Whereas religion, we can get into conflict, but the religion is not really what we're after. We're after relationship. So if we can get here, then we can really help the medical doctors help us. So ultimately, this is an individual's physical attempts in order to be acceptable to God. So you're trying to do all these things, trying to do this, trying to do that, and ignoring the fact that He's actually reaching down to you. So here we go, an integrated model. This is what I'm proposing. Not very many psychologists think about this stuff. And I believe that there are a lot more medical professionals who think about it, but they're not engaging their clients and their patients in it. And if they are, they're not doing it enough, or they're not doing it as effectively as they could. That's not to put them down, that's just to say, we've got to take it to the next place. So this is my proposition as we get into an integrated model. We are spirit, we have a soul, and we dwell in a body. Spirit is that invisible essence of life, the intangible presence, that's God, which allows us to experience the reality of what we can't tangibly prove. We said that earlier, science can't capture God, so we need to stop expecting it. Soul encompasses our thoughts, our attitudes, our mind, our will, emotions, that which allows us to interact with our surroundings. Oh, I love you, our emotions. That allows us to connect and interact with people in the world around us. Body is a physical casing which protects and shields and distinguishes us. One aspect of our being, the body, the soul, the spirit, one impacts the other. That's what's vitally important. Your thoughts impact your emotions. Your emotions impact your physiology, which the medical doctors will love, the physiology part, which will impact all of these other things. And there's a link and there's a connection. So this is a diagram of what we're really talking about in the integrated model. So here's the individual, the man or the woman. They have a body, they have a soul, and the soul is made of the mind, the emotions, the beliefs or attitudes, and the will. Okay, that's the soul. And then we also have these social interactions that are also very, very important that we can't leave out. Even the Bible tells us that we should forsake not the fellowship. And so this is vitally important if we're being encouraged not to leave it out. And then here's the spirit. And I left this last, and I have it in a different color, because this is in essence what we're trying to bring out and utilize more, because we've underutilized this part of the human experience. We get the fact that we have a body, we get the fact that we have mind, emotions, all these things, but sometimes the profession forgets the spirit part of man. And when I say man, I'm not being gender specific, I'm saying humanity. And we've got to now start including it. So the mind, body, and spirit connection. This is what researchers have been able to prove. 98, 2002, 2007, 2008, and even more research, that mental health will help increase the immune system, will help make the immune system be able to fight cancers, to be able to deal with and address some of the medical conditions that we're talking about. It increases physical health. We're talking about heart conditions, blood pressure, cholesterol, and if I have, how much time do I have? I have, okay. I'm going to read this really, really quickly. And then I won't read the other stuff. I brought a couple of books because I wanted you all to know that we are increasing the empirically based, which is what the science is looking for. I get it. We need it. Absolutely. I'm not dismissing that. But what I'm saying is that is not enough to tell us that this is it. Meaning, we can't say just because we can't prove it empirically that it doesn't exist. That's the only point that I'm trying to make. So this book has been written by Dale Matthews, who's a medical doctor, and Connie Clark. It's called Faith Factor. And then there's another book that's called The Healing Power of Faith by Harold Koenig, who's a really, really, very progressive physician, psychiatrist specifically, who's dealing with some of these very matters related to spirituality and medical health. And so there's a statement here by one of the physicians, and it says, is there an association between religion and health? Yes. Religious involvement is associated with positive effects on health in numerous studies of different designs, says one of the medical doctors. He noted that more religiosity or more religiously strict groups like Orthodox Jews, Latter-day Saints, the Seventh-day Adventists, other Christians appear to enjoy greater health benefits because of their religious commitment and their healthy lifestyles. Even when religiosity is measured in less strictly observing populations, data from multiple studies show a trend towards better health and less morbidity and mortality across the board in the presence of higher levels of religiosity. Now, we just define spirituality and religiosity. They don't define it in the same regard. So I just want you to know that they're talking about intrinsic spirituality. It's really what they're talking about, but they call it religion. The trend is observed in many denominations and for many aspects of both physical and mental health. They've done tons of research. They interviewed several people. They have a lot of studies in that book that that demonstrate individuals who were diagnosed with cancer and who were encouraged to use their faith, that their rates of recovery and healing and the process of managing taking the medications and having to go through the treatment process is more manageable when they're able to integrate and use their spirituality and their belief systems. So these are some of the things that we know. These are the things that are taking place. And just because of time, I want to really kind of get through some of these slides as quickly as I can. The mind, body, and spirit connection, again, physiological effects, changes in the brain waves, and the neurochemical alterations when people meditate and when they pray. Meditation, really quickly, is really reading. Let's say, for example, you pick the word up and you read it. Meditating is kind of like, what cows do when they chew their food. They chew it, they roll it over, swallow it, and I don't mean to discuss anyone. I know we're going to be going to lunch in a few minutes, but then they regurgitate it and they chew it up again and they swallow it and it comes back up, and that's what meditation really is. When we're really focused on it, we're thinking about it, and it gets into our spirit, and it gets into the essence of our being. So that's kind of what we're talking about when we talk about meditation. And meditation encourages that quiet place that Dr. Yu was talking about, that quietness, which actually releases the kind of frequencies that Emoto mentioned as being very, very powerful.